Admiral Wiyaki, I noted the service's proposal to extend special personnel authorities provided to the Department of Veterans Affairs under Title 38 of the United States Code to its employees, the service's employees. The law already allows the Office of Personnel Management to delegate certain authorities regarding pay and hours of work to the service, and you are seeking a legislative change to expand IHS access to all Title 38 authorities, including those that govern collective bargaining and adverse personnel. You seem to focus on the Title 8 authorities' pay incentives, but IHS already has those. Given the service's longtime track record of whistleblower retaliation and reports of nepotism going back to the 2010 Dorgan report, Congress needs to fully understand the service's intentions before it can consider this proposal. Can you tell us precisely which Title 38 authorities the service can and cannot access currently? Why is this legislation necessary when you already have many of these authorities?
Thank you, Senator Udall. And related to Title 38, our major focus is on pay bands and incentives. So
But you already have those.
we have the ability to access via a very administratively burdensome process, and we have to submit individual requests that take months and sometimes years to develop. Give you some recent examples. We've created pay bands for our certified registered nurse anesthetists, CRNAs. That's a mouthful. And the packages that our HR office has to put together, gathering the justification information, all of that work would be alleviated. Those months of work would be alleviated if we could just access directly the Title 38 VA pay tables.
Now, you said the IHS needs access to Title 38 employee discipline authorities. Can you state why you believe access to these specific authorities is necessary and how the administration believes they will directly benefit the service?
Thank you, Senator. I think one good example is the 2-year probationary period that comes with Title 38. We currently have 2-year probationary authority in the Indian Health Service for Indian preference employees hired under accepted service. We don't have that same authority for a 2-year probationary period for clinicians who are hired into physician spots. If we identify an issue with that provider's performance early on in the first 2 years, we would be able to address it much more readily. Another authority that comes with that Title 38 authorization is that cases for clinical competency, clinical concerns, would not have to go to the MSPB, Merit Systems Protection Board. They could be handled within the agency by, with the expertise of a healthcare system that understands healthcare operations, hospital operations. So having the ability to assess clinical competency by a health care entity as opposed to a Merit Systems Protection Board would be another good example, and I think one of the reasons why the VA has that same authority.
You know, shifting over quickly here to the Gallup Indian Medical Center, I know they've gotten $2 million in planning funds for fiscal year 2019. Replacement of this facility, as you know, is desperately needed, as you saw last year when the facilities issues contributed to the GIMC nearly losing its accreditation. I understand there have been discussions with the Navajo Nation about finalizing a site for the project, which is critical given that the project is already finally ready to start moving. Could you please let us know what the status of those discussions are and what steps IHS is taking to finally break ground on the facility replacement?
Thank you, Senator Udall, and we appreciate the fact that Gallup is, after all these years, now close to the top of our grandfathered healthcare facility replacement list. We know after being here last year and sharing with you some of the concerns that we faced with accreditation and certification at that location. GIMC was built in the late 1950s, opened its doors in the early 60s. So it is one of our most aged facilities and very much due for replacement. Admiral Hartz can provide us with the site selection reviews that have been underway. I know that I met just about a month ago with President Nez from Navajo Nation, and he came with a new proposal regarding the Gallup Indian Medical Center site selection. And we know that there's a lot of interest from the City of Gallup mayor, the New Mexico State Governor, Governor's office. We've had a lot of interest in this particular project. And so I'm going to ask Admiral Hartz if he can give a latest update on where we're at.
Thank you, Senator Udall. Good to see you again. We had 2 daughters born at GIMC, so I'm very familiar with that facility. As Admiral Wiaki's indicated, this facility's been on the list for quite some time. We did go through an initial site selection evaluation in '05. We looked at 10 sites within and near Gallup, and from that identified top couple sites. Then more recently with President Begay of the Navajo Nation offered an alternative site, which we embarked on a couple of years ago, another site evaluation. And when looking at that, based on the site that the nation was proffering, based on that review, we went back and looked at the top 3, added the newly recommended site, and the number 2 site on the previous evaluation became the number 1 site. And then about 6 months ago, 4 to 6 months ago, the current president proffered another site. We are currently looking at the viability of that. We have not progressed to a formal site evaluation. We are looking at the viability. We are anxious to move forward on the construction of this much-needed facility. This committee has given us tremendous resources to move forward on all of the projects that are on the grandfather list. Now have money in them to move them off the list, and this is a big one. And that planning money is in a position now so we could actually start thinking about what it's going to be regardless of the site. But we need to make that decision, and we're looking forward to moving this project along.
Great, thank you.